Hi, good morning, good afternoon, good evening, everyone who is in the chat and anyone who will be watching today. It's a Friday. Friday things are a bit slow and we do things a bit because it's the end of the week. Some people are traveling, some people have got plans. So today we we will go through faster some things and some issues that are concerning herbal medicine because we the current generation right now, or most of the people, when they are sick they go to hospital. When people get sick they go to hospital, but when you go to hospital you are not given uh, the drugs, the herbs that people are given in you are not given the herbs that people are given were given sometimes ago. Now we will go through this topic and we will cut short the topics of herbs and we will give the reasons why it is important to study, why it is important to study these herbs, even if we have the normal, uh, even if we have the normal drugs that we usually have in the hospital. As a doctor and a medic, at times it's very important to study these drugs. It's very important to study these drugs and know why uh, our forefathers used. There are several reasons why we should study these drugs. First of all, the first one, you know, herbs are the generation of the modern medicine. As we study every drug that we've been going through the herbs, although we still have some other drugs that we need to go through, as we study them and go through them, you find out that many medicine that were used today are derivatives of the herbs that we usually see, and some people who use herbal medicine use them. You get it. Many medicines that are used today are the derivatives of those medicine. You get it. Many medicine used today were discovered from plants. By studying the herbs, learn how natural chemical treats disease and use them to develop modern medicine. You get it? They help to discover for new medicines. See, many plans today it will be a short meeting because they have to do some other issues. So I'll go quick on why we should study this medication. And someone will ask me, as a doctor, why are you advising or telling people to use? No, I'm not telling people to use. Remember our talk about complementary and medicine and conventional medicine when we started. So I am taking a break to enlighten people about this topic and minute to enlighten people about this topic so that people may know what to do when there is a problem and there is no conventional medicine. So we speak on a minute, just a minute, some distraction here. Yes. Now, herbs are the origin of modern drugs. That one we have said. And then help in discovery of new medicine. Hmm? Herbs, the scientists use the same herb and they use history that was written by our forefathers. That was written by our forefathers to prescribe, to come out with new medicines. You get it? It is very important to know that. So as we continue, at times, they also provide affordable treatment options. When people have flu and they are using concussions, they are using the leaves. You see, people get better and they don't go to hospital. You have had people that have used herbs and they got healed. Some other diseases that have been disturbing them, and they are okay to now. So it is important to note that these herbs sometimes they provide affordable treatment options. Herbs medicine are often cheaper compared to manufactured drugs. This helps people who can afford we can't afford expensive hospital. There are some places where before you get to hospital it's very far, and the means to get to the hospital is another expense. And when you go to the hospital, you don't have money to for the medical services because the drugs are very expensive. So they provide cheaper method of sorry of they provide cheaper methods of healing, drugs of healing. You see, they are easily accessible in many commodities. In rural and remote areas, hospitals and pharmacies may be far. Get it? Herbs can be only locally grown or collected, making treatment more available. You get it? Making treatment so more available. There is a picture I wanted to show you. Try see. Let's see, it's loading now. It's okay. Let's continue. Let's just continue. Okay. They help health workers understand patients' herbal use. They make health workers understand patients' herbal use. Get it? Mm? Sometimes this help health workers to avoid to health workers to understand patients' herbal use. You see, when you as a patient have used a herb and I'm the health worker or a doctor or a nurse or a clinical officer, I will start understanding how the herbs behave towards you. So as you use the herbs and you come to hospital, and I'll understand many patients use herb remedies secretly alongside prescribed drugs. This is often, it's normal. Studying herbs helps healthcare to provide and give better medical advice. You get it? So you should not hide it to your you should not hide it to your doctor that you are using a herb. You should just tell your doctor that you are using herbs. You get it? They help prevent harmful herb drug interaction. You get it? Some herbs can increase or reduce the effectiveness of conventional medicine. Knowing these interactions helps doctors to prevent complications and side effects. You see, by you taking the herbs and you come to hospital and we give you some drugs and we already know you are using this herb, although it was helping you, but the interaction and adverse effects that will come will make us know how to balance our drugs. So it is not good to secretly take the drugs and you don't tell your medical practitioner or your doctor. It's important to tell your doctor this is the herb that I'm taking. So if you're taking that herb and it is effective, and if I give you another conventional drug, let me say the drug in hospital, and it works even better, I'll be advising someone in future that use this, it can boost the effectiveness. But if you use and then it's not working better, it reduces the effectiveness, I will advise someone, no, don't use it because it will not be effective. It will bring this. So it helps prevent herb drug interaction by some experiences we get through our practice. You get it? So these are the importance. There are so many importance as we continue. We will continue with the herbs maybe tomorrow or next week, but let's get to know why it is important us as doctors and the community to study the drugs. A person asked me, why are you talking about herbs and you are a doctor? Now I'm going through this so that that person could understand why I'm going through this. They provide alternative treatment when conventional medicine fails. You get it? Sometimes conventional medicine can fail. You have seen that. Some drugs get resistance, and you treat someone, this person is not getting better. We sometimes go to herbs, and you see some herbs may be better, they may respond better. So it is an alternative treatment to conventional medicine, but not always. But not always. And at times they help reduce dependence of synthetic drugs. Let me ask, if you are the one who is having the problem, and then you use herbs and you are okay, would you mind going to a hospital? No. So they all provide alternative treatment to conventional medicine when it fails, and also to reduce dependence on drugs that are manufactured. Manufactured drugs, I say, they are expensive, and being expensive also, they have sometimes are so toxic to your body because of the manufacturing process. So the herbal and complementary medicine, they provide alternative uh, treatment to conventional treatment. You get it? So that is the most important thing. They also help reduce dependence of synthetic drugs. That one we've talked about. They help to reduce dependence on synthetic drugs, so that you, as you take these drugs, if you have a headache, you take a glass of the one of the herbs and it works. You see, you have reduced your chances of taking paracetamol, brufen, those painkillers, diclofenac. You get it, meloxicam, cox B. So that drug that you are taking as a herb may be having nutritional value and may be having anti-inflammatory value, so it's giving you double help. But if you come to hospital, you have a headache and I'm treating you, I'll give you paracetamol, which only reduces the headache. You get it? They may have fewer side effects when used correctly. This one, I said, they may have fewer side effects when used correctly, but you should be given by a person who has experience, who has an apprentice of a person who passed it to him or her and knows what he's doing, not just taking and drinking things that you don't understand. You get it right. It is very important to note that. Fewer side effects when treated correctly. Hmm? They support holistic treatment. When we started this topic, we talked about holistic treatment and the how these drugs of complementary medicine work. Hmm? Herbal medicine often focuses on treating the whole person, including physical, mental, and environmental health, rather than only treating the symptom. Because now you're taking herbs and they are green and they have vitamins and other, you get it. So they don't only provide the cure, but they have other benefits. They have other benefits. So those are like 12 points, and we have so many points. Why, as a doctor or a modern person in the modern society, why should you use? Why? Why should you talk about complementary medicine and use of drugs that are herbs? You see? You see these points, they are very important. Herbs are, let me repeat the points that we have gone through. Herbs are the origin of modern drugs. They help improve or discover new medicine. They provide affordable treatment. They are easily accessible in many communities. Easily accessible. They help healthcare workers to understand patients' herbal use and interaction to the body. You get it? They help prevent harmful herb drug interaction. You see, very important. Yes, I heard someone say the same thing from someone who could, let me read that. I heard someone say the same thing from someone who could be my father when I was growing up. Yes, you see, it is very important. And even you can attest, who are watching, and this I'm not the these things came even when I was not born, and we are just picking up where the other people started from. You get it? They help prevent harmful drug interaction. Very important. They preserve tradition and cultural medical knowledge. We should be proud of our tradition. We should preserve our good traditions because some of them made our grandfathers and our ancestors live long years without having problems. You see, the current problems of this generation, are most of them are brought by ignoring our tradition. Social delinquencies, people are living lives without direction. But if we go back to tradition and follow our forefathers, everything will go to normal. Even respect and disrespect today, most of them are because of the tradition. There are so many good practices and traditions that we have left, and we are doing things the way we want. Herb medicine can be passed down to the generation. Studying herbs protects valuable traditional knowledge from being lost. You see, every every community has got its practice in cultural and medicine practice. There is no culture that has no practice of herbs or medical practice. Find out from your community, you will find out. They provide alternative treatment when conventional medicine fail. We've talked about that. They help reduce dependence on synthetic drug. Very important. Depending on over-the-counter drugs and medical hospital drugs, they may have fewer side effects when used correctly. You see, but that one I've said you should be prescribed by someone who is really into this. He knows or she knows what to do. You get it? Nowadays we study herbs in hospital, and the study of herbs in hospital, we have integrated it so we can advise. For the long time that we have been studying herbs and giving our conventional drugs, it has helped us to give the drugs in a good way so that they balance. As you use the herbs, we are advising you on the drugs that we are giving. They support treatment, holistic treatment. The herbs medicine often focuses on the treatment the whole person, including physical, mental, and environmental health, rather than only treating symptoms. There are some herbs, the medical herbs that we use in hospitals. Some of them also, you see, for painkillers, we'll always treat pain, but they don't have any other additive. You get it? But if you get these herbs, you will take the herb, it has vitamins, it is treating it is an antimicrobial, and it's doing something health to your life, like reducing cholesterol. There, we have not finished about the drugs. As we continue, if it will continue tomorrow, today is on Friday, you will see there are herbs that are reducing cholesterol in your body. You see, there are some herbs that you will see that reduce cholesterol in your body. So we continue, and we say also they are important in preventive medicine. They are important in preventive medicine. Some herbs help boost immunity and prevent disease before it develops. Prevention reduces healthcare cost and improve quality of life. You have seen there are some drugs that we have seen, like the African pruners, Prunus africanus, that we say that helps in prostate cancer. You saw it is preventing men from getting some complications, and it helps you not to use a lot of money when you are going to the hospital. You see, preventive medicine. You take a glass of Prunus africana, you are helping yourself as a man to reduce the visits to hospital. Hmm? They help in managing chronic diseases. Some herbal therapies can support long-term management of diseases such as diabetes, arthritis, and hypertension alongside conventional medicine. We went, if you have not gone through the other topics, previous one, go through, you will see there are some herbs that when you take, they reduce blood pressure. Hmm? You see, now this is a very keen and good topic to study. It was started by other generations, but we are picking up as the modern generation and we are integrating it to the conventional medicine. Yeah? They provide raw materials for pharmaceutical industries, like the Prunus africana itself. There is a drug called tamsuline and phenocin. Those are drugs that comes from Prunus africana, and they really help when it comes to prostate hyperplasia plus benign prostate hyperplasia, prostate cancer. You see, they provide raw materials to pharmaceutical industries. They encourage biodiversity conversion and plant research. Go right now to every research body in every country or state. You will find they are using herbs on their research. There are some herbs that are being researched for decades. Even now, it's still being researched, like aloe vera. It is still under research even right now. And you know, we have more types of aloe vera, like 20 types. These are the advantages of this. They are the advantages of studying herbs. They encourage conversion of plant and research. Very important. They improve integration between traditions and modern culture. Integration means assimilating, using both tradition and modern culture. Study hubs allows healthcare system to combine safe traditions and remedies with science, medicine, improve patients' outcome. You know what we are doing in hospital is only we want the patient to be okay. But there are sometimes patients can come to the hospital, you are trying your best, you are really trying your best, and this patient is not coming on okay. But you are told by the village elder that use this and this patient will be okay. Some people turn them away and then the patients end up having problems. Janet Harris, welcome to the platform. Yes, we are talking about why we are talking about herbs and the current society is a modern society. We will continue about it, about studying about the specific herbs tomorrow or next week. So when we come to study about herbs, as a medical practitioner or a modern society person, don't turn away the older generation or a person who has an experience on herbs, because it may be the better way of sorting some issues rather than the conventional medicine that we have. And mostly you have seen, mostly in cancers, you have seen some people use herbs at home and they really improve. But when they go to the hospital and they are done chemotherapy and radiotherapy, they really deteriorate. There are some herbs when you use it, and we saw there is one herb we saw to our previous talk that when you use it, the cancer cells reduces. Although we have not finished the herbs that I'm supposed to finish, we will continue tomorrow. Today, I'm talking because so many people are asking, why are you a medical doctor and you are talking about herbs and complementary medicine? Hmm? It's important to study them because they are the basic basis of what we do, and the drugs we the raw material comes from it. You get it? So let's talk about the improved integration between tradition and modern healthcare. Studying herbs always allows healthcare to combine safe traditional remedies, and not that word, safe traditional medicine with scientific medicine, improving patients' outcome. So today's topic is short. I'm just clarifying why we as doctors or some doctors are talking about herbal practice. We call it complementary medicine, and we are conventional medicine people who practice modern medicine. These are the reasons why. And we started with the drugs. We are not only talking about drugs alone. This is a wide range of diversity, and we will talk about even the medical practices that were used long time ago. So as we continue, We don't have a lot of time today. If you have any question, please just ask the question. Ask the question as we continue talking. Today is just clarifying why, as a doctor, we decide to talk about herbs, and you've seen we have so many points about it. So if you have a question, I still have 10 minutes, I think. 10 minutes. Please ask the question. Ask the question as we continue. They improve integration. That one we have talked between the traditions and modern medicine. They help in community-based health programs. Community-based health programs. Local herbs knowledge can be used in community health programs, especially where medical resources are limited. There are some places we don't have hospitals. There are some places before you get a pharmacy to get a drug is very far. But if you have a smartphone and you are watching me and the way we have discussed those herbs, you can see you can get help just right next to your door before you plan how you can visit a doctor. You get it? They help in community-based health programs. Local knowledge can be used in community health programs, especially where medical resources are limited. They support self-care and health awareness among populations. They support safe health care. Learning about safe herbal use encourages people to take responsibility for their health and lifestyle choices. It is safe to know, and I say, don't go to people that you seem they are quacks and they just want to say. Herbal remedies and complementary medicine, they have specific people who are specialized in them, and they are taught through apprentice and they are passed on through generation. In every community, you will hear there is one person who knows and is the specialist in this. Go to them. Don't go to anyone. You know, current society, very many people do very fake issue things and issues. So as we talk and as I speak, the materials that I'm using to talk to you about the herbs and what, these are under, they are things that we do research, we document, we write. We don't just do them like the herbs. We do research. We do research on them. Hmm? You see, even I really pray God that as I continue working on my little hospital, I come with a bigger platform whereby I'll have a place where we just research on herbs and better medicine and herb use. You get it? I wish that comes true one day. They provide options during drug shortage or high cost of drugs. That one we talked about. There are some drugs that are very expensive. So in if you can get a painkiller through herbs, you are a doctor, because some doctors do not want to enlighten. You are a good doctor. Listen to what Jamaican uncle say. You are a good doctor because some doctors do not want to enlighten patients about local herb because they don't care if a patient cannot get help if they can't afford to go to the doctor. Yes. And it's so painful. It's not good to do that. If you cannot get to a hospital or a doctor and you know I can take this herb and get help, it is good to save life with the what you have. Not everyone is near a hospital or not everyone can afford a hospital. You get it? And this comes to me as a question that when I I start building the hospital of my dreams, there are some things that I will not be charging. There are some research of medical students that I will not be asking for charges or what. Researchers will be worldwide. You come, if you are a student, you research for free, you use equipment for free, and then because there's out there are so many talents that are wasted because of resources, which is so bad. You get it? Let's continue to the last one. I think today we are going to 30 minutes. I'm left with a minute. And there is no question today, which is so good, but it's okay. You can ask you. Everyone has my email number. Every time you're free, you can ask every question. Now, they contribute to scientific research and evidence-based medicine. Study herbs helps researchers to test their effectiveness, determine safe doses, and turn traditional remedy into scientific proven treatment. All this medicine that we are using in hospital, all this medicine that we have currently in hospital, let me tell you, it is because of traditional medicine. If not for traditional medicine, the pharmacist to go to the bush to get a certain drug that it was used by our ancestors, we could not be having conventional medicine right now. So I'll go through those points again as I finish. More than 20 points. I want to pinpoint them so as that we, when we speak and we talk about herbs and traditional modes of practice of medicine, you know what we are talking about. You get it? You get it. Thanks a lot, Dr. Jamaican Uncle, for that. Listen to this. Number one, herbs are the origin of modern drugs. And this is why I'm going through drugs as I'm a conventional doctor. Listen, herbs are the origin of modern drugs. They help in improve of new medicine. They provide affordable treatment options I have explained. They are easily accessible in many communities, very accessible. They help healthcare workers understand patients' use of herbs. As I speak right now, I know there are some people who have got help. Yes, they help prevent harmful drug herb interaction. Mhm. They preserve tradition and cultural medical knowledge. Very important. We all came from somewhere and we should preserve our traditions. That's why when I visit America, I visit Jamaica, I visit the UK, I'll visit the places that traditions are preserved to see how these people lived a long time ago. They provide alternative treatment when conventional medicine drugs fail. You get it? They help to reduce dependence of synthetic drugs. Uh-huh. They may have fewer side effects than the other drugs that we use in hospitals if used correctly. They support holistic treatment, the body, the mind, the spirit. The body, the mind, the spirit. Holistic treatment. You get it? They are important in preventing medicine, in preventive medicine. Very important. They help in managing chronic diseases, hypertension, diabetes. Some drugs here that are herbs, they help reduce this. You get it? They provide raw materials for pharmaceutical industry. Every drug that is being manufactured in the pharmaceutical industry comes from these herbs. Hmm? So you are getting my point. Why I'm coming live to talk to my people to enlighten them about complementary medicine, because we are using them and they may be a good remedy. They encourage biodiversity, conversion of plant research. That is 15 points there. They encourage biodiversity of conversion and plant research. Every herb right now, most of the herbs, even HIV treatment. Right now, there are so many herbs that are going through research if they can suppress that virus. They improve integration between traditional and modern healthcare. You see, integration. How can we use herbs and modern healthcare for a body of a person to be better? Hmm? And you see, they can, let me tell you one thing. You can find that the integration between the modern treatment and the other treatment, the complementary, you will find that hospitals can turn out to be using more of the complementary medicine. Don't be surprised one day if we get there. They help in community-based programs. Local knowledge can be used by community health programs, especially when medical resources are limited. They support self-care and awareness among population. They provide they provide options during drugs shortage or high cost of drugs. As you wait, God bless you, Dr. Might continue. Listen to Mike's. Mike has said, God bless you, Dr. Benjamin, for your kindness and care. May He continue bless, fill your cup. Amen, 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 Mike, amen. Thanks a lot for that. Janet Harris, thanks for being here. And even Jamaican Uncle, please, amen for those texts. Now, the last one. They contribute to scientific research and evidence-based medicine. Herbs and the complementary medicine are scientific proven because right now they are in. You see, I talked about the African pruners, and it is real. If you are a man and you take African pruners, you'll be helping yourself when it comes to prostate cancer. You see, it has been proven. So thank you a lot. Today I was just enlightening people and on matters concerning good health and why, as a doctor of modern medicine, I'm trying to go through this. Please share this video. If you've not liked it, like it. Talk to people about it. It's not that doctors will despise herbs and traditional practice. No. Yes, there are some that do that because they think they are knowledgeable than our forefathers, but there are other cadres of doctors and medical practitioners that don't do that. So I think today there is no question. I just came online to talk to people and tell people why we are talking about the modern medicine, which is the conventional medicine, and complementary medicine, which entails the past practices and herbs, so that people can know why I'm talking about them. And people have the enlightenment today. So we will continue from tomorrow on the herbs themselves. We will continue. Janet Harris, thank you so much. We will continue tomorrow. I know Jamaican uncle, we talk a lot, and he knows my dream of building that hospital, which is coming to be true. When it comes, you will see, and I will be bringing the researchers live. There are so many researchers that are kept that you cannot know. So wherever you are, thank you so much. Be blessed. And today was just a short session. Tomorrow we will continue with our herbs and practices. We are still working on the talking about herbs that our forefathers used. And some people are so surprised that the herbs that they think, the drugs that they think they have in hospital, they come from the normal flowers they see and the trees that they are around with. You get it? So let's meet tomorrow to continue our topic on the herbs. Today was a clarification. Yes, yes. Thank you so much, Janet Harris. Yeah, thank you so much. Let's continue tomorrow on our topics. And it's a Friday. Say hi to families and everyone. Enjoy your day. Be good, stay good. Nice day, nice evening, wherever you are. Let's see. I encourage people to look into and practice good health, and most important, to look into great physician Jesus Christ. For it's very important. The great physician Jesus Christ and the Lord, very important. Have a nice day. Let's meet tomorrow, everyone. See you as we continue our topics. God bless.